So your doctor prescribed a surgery because you have some symptoms. It's not an emergency surgery, but they think it might help. If you got this question and you're wondering, what the heck do? I don't know what to do. This video is for you. I'm gonna explain in this video on how to give you some tools to decide, is it necessary, is it not necessary? And we're gonna get started right now. Hello everybody, I'm Dr. Glenn Harrison and welcome to this week's segment of Why. If this is your first time on the channel, you want to learn more health-related tips and strategies, make sure you click the like button, hit the subscribe and the notification so you don't miss any, because over the weeks and months we're going to be throwing more and more out your way. So the question is, and I do get this, in fact I've had about 3 this week already. Dr. Harrison, I'm dealing with all this stuff, all these symptoms. My doctor said maybe if you have this surgery it might help. You know, this is kind of all we got. And they're like, what do? I would like to keep that organ system, but I don't want to go under the knife. Is there anything I can do? Well, I would say yes, there is. However, if this is any kind of emergency, don't underestimate your doctor's skill set. If you don't like the answers, definitely go get a second opinion. I'm always an advocate of people going to get second opinions, even if they come to us, and to go see other clinics and see what their opinion, what their advice is, what their guidance is. So now that that's out of the way, but a lot of people, they have they're given these, the proposed surgeries that they're kind of guessing. Maybe it'll work, maybe it won't. It's usually when they don't have any other answers. Gallbladder surgery is a big one. Removing like hysterectomies is another one. Ovarian removal is another one. They think it might help, they don't know. Another one is even tonsil removal and adenoid removal, as well as appendix removals. Now, any of those removals, those organ systems, they could be either emergency situation, or they could be, let's just see if it's going to help. The problem with let's just see if it's going to help is once the scalpels come out, there's no reverse. You can't undo that. And when you remove those organ systems, if they don't need to be removed, your body will never run the way it once did. Those parts aren't extra. When you remove them, they have significant, important functions. When you remove those organ systems out of the body, your body will never run as optimal. That's just the way it is. So we got to remember we're given these parts for a reason, and we should think twice if we have the opportunity and there's time before we just go and pull those out. Okay, and the reason why the medical community, the conventional medicine, is well, maybe we can remove it, because if they don't have any other solutions, it's either going to be it's going to be a drug or scalpels. It's going to be either a drug or a surgery, and if the drugs don't work, the next thing is the surgery. So there's a place for them. I'm an advocate for them. I'm referring out all the time when those are necessary, but this is for, again, non-emergency situations, like a gallbladder, for example. I keep saying gallbladder is the most commonly prescribed surgery. A lot of people have their gallbladders removed and they don't feel any better, and naturally then they have problems digesting for the rest of their life. So, with that being said, what can we do? Well, recognizing the standpoint the medical community is coming from, they don't have any other tools, but if it's not an emergency setting, I highly recommend get an evaluation. Recognize that these organ systems are needed. And if it's not an emergency to pull them out, do what you can. So these organs, I say they have a purpose, they all have a purpose, but if they become dysfunctional, not because they're a faulty organ system. 99% of the time, it's not a faulty gallbladder or a faulty appendix or faulty tonsils or faulty adenoids or what have you. They get dysfunctional and they become damaged when there's other systems in the body that are problematic, that are creating problems, and then there'll be sometimes there's a specific organ that takes the brunt of the trauma, and then it can become inflamed and infected and all these things. But the organ isn't the problem. It's all of the other things that put extra strain on the organ, and then it was the weak link. So if we think about it like that, I have many people that come into the office, many people. Gallbladder's a big one. Appendix, it's hard to catch that one before it's an emergency. We have seen hysterectomies, you know, they're recommending ovarian removal, and we've been able to catch that before it was needed. Not always, but many times. So look at the whole picture. I highly recommend, get another opinion. If another medical doctor's opinion is just going to be another form of drug or surgery, you're going to want to find a natural doctor that's going to do the lab test, that's going to diagnose and find any other dysfunction that's creating that organ system problem. Because once the knives come out, you can't reverse it. So hopefully this creates a little bit of clarity. Is it an emergency situation? Do what the doctor says, do what your medical doctor says. If you don't like, get another medical doctor because it's an emergency. You don't have time. If it is not an emergency and they're thinking it's going to help, but you've been dealing with all those symptoms and you have time, explore another strategy, because that organ system 99% of the time isn't the cause of the problem. It's an outcome. It's a symptom of other problems. You pull that organ out, you're going to have even more challenges down the road. Those parts have purpose. So hopefully this was helpful. I feel free to reach out to us if we can help, or we can point you in the right direction, or even explore this with you. If not, we can send you to a clinic or providers that we know of, hopefully in your area. But yeah, there is hope. So with that being said, I'm Dr. Glenn Harrison. I look forward to talking to you next day, where we're going to answer the why to another health-related question. Have a great day.